Hello viewers, good morning, good evening, good afternoon, depending on where you're watching me from. Welcome to my eMTCT channel. My name is Linda. I'm a registered nurse and I have worked serving people living with HIV for more than 10 years. So there is something that has prompted me to start this channel so that I can give pieces of advice to women of reproductive age. So many times when young ladies come to the antenatal clinic and we do for them counseling on what is expected of them, I've realized that even though there's so much literature about antenatal care in regards to HIV, so many of them are green. So this has prompted me to start this channel so that I can let our viewers know what we are doing, what's available, the achievements we've had, how far we've gone, and what we are able to do right now. So welcome. Please remember to subscribe, like, share, invite your friends, forward to them so that they can learn too. And if you subscribe, you'll be able to be notified when I post the next videos. So today I want to talk about a couple in a discordant relationship. That is a lady who is HIV positive in a relationship with a man who is not HIV positive, or a lady who is HIV negative in a relationship with a man who is HIV positive. Don't even think that they don't exist. They exist, sometimes knowingly, sometimes unknowingly. So many ladies get to know their HIV status when they come for antenatal clinic. And to start with, I would like to encourage my viewers that please, it's important to know your HIV status. Yes, right now we have self-test kits. You can just walk into a pharmacy and buy. Remember to be very brave when you want to do a self-test. Pre-test counseling is very necessary, and post-test counseling so that you're told, you are advised on how to live with your result. If you test negative, it's important that you are still advised on how to live negatively. Yeah, and if you test positive, it's important to get post-test counseling so that you're advised and you're given care immediately, because with HIV, the faster you're managed, the best. So let me talk about a lady who comes for advice. She is HIV positive, living positively. She has a partner who is HIV negative who knows her HIV status and she wants to conceive. First and foremost, it is very important to come and let us know that you want to conceive so that we can do checks and give you an okay. When I say that we are supposed to give you an okay, remember that your partner is HIV negative and your intention is not to infect him. You are HIV positive, you want to get a baby, but of course you want to get a baby who is HIV negative, and I'm going to give you an advice. It's very possible. So this is what we do. We will do a viral load check for you. A lady who has undetectable viral load cannot transmit HIV to her partner. You cannot infect your partner. To have a low viral load means that you have less than 50 copies per deciliter of blood. Yeah. And your partner also, we will manage him. We will put your partner on pre-exposure prophylaxis. Pre-exposure prophylaxis, the type that will put him on is the once a day pill. Once a day pill is a type of ARV that is taken daily, but by someone who is HIV negative, and it starts functioning on day 7. When you start taking it today and you want to get involved in unprotected sexual intercourse, it will not protect you on day 1, 2, 3, 4, 5, 6. It will protect you as from day 7. And once day 7 has reached and you are ready to start exposing yourself, remember to keep on checking that pre-exposure prophylaxis for 28 days. In essence, what I'm trying to say is that it is us to initiate you on pre-exposure prophylaxis and to stop you. Why is it important for us to initiate you on pre-exposure prophylaxis? Because there are investigations that we are supposed to do. Like we are supposed to check your kidney functions. We are supposed to check the status of your cardiovascular. There are some factors that we have to consider. So what I'm trying to say also is that not everyone is qualified. Okay. Again, I've said two things. One, the lady is supposed to be having a suppressed viral load, and the man is supposed to be on pre-exposure prophylaxis 7 days prior to exposure. Another very important thing is that the lady needs to be in her fertile window. That's the reason why you're supposed to come to us in time, so that by the time your fertile window comes, your partner is ready, you are also ready. So when I talk about fertile window, when is a lady fertile? What is this fertile window all about? So fertile window can only be used by ladies who have 28 days cycle. If you are a 31 day, 35, sometimes you skip, we cannot guarantee that you will be fertile on certain days. So for a lady who has 28 days cycle, day 1 is the day when you see the real blood flow, not a spot. Remember, when menses begin, you start with a spot for a day or so, or some hours. That is not your first day. So day 1 is that day when you see a blood flow. So that is day 1. Then you count day 2, day 3. Most of people are through with the flow on day 3 or maybe day 4. We go that way. Day 5, day 6, day 7, day 8, day 9, day 10. You're fertile. You'll be fertile for 1 week. So that means that you'll be fertile up to day 17. Why am I saying that you're fertile on day 10? And we know very well that ladies ovulate on day 14. You're fertile on day 10 because a sperm can stay alive for 5 days in your genital tract. Yes. So that means that if you have an intercourse on day 10, by the time you're ovulating on day 14, the sperm is alive and waiting. Waiting for the ovum. And if you release it, it will be fertilized. After day 17, you're supposed to stop having unprotected sex with your partner. By that time, if you released an egg, it will be fertilized. Your partner will continue taking PrEP, and we will continue monitoring you. Every 6 months, we will be doing viral load to see if you're still suppressed. Because suppression is still important. You're going to deliver. You're going to be breastfeeding your baby. In as much as your partner will be safe, he has taken PrEP, and he's not exposing himself after 7 days. This partner of yours will be testing him after every 3 months too, for his own safety. After some time, he'll stop using PrEP. It is us to stop him from using PrEP. When you give birth to your baby, you will be giving ARV prophylaxis to the baby at birth, and you will continue until complete cessation of breastfeeding. Some of the drugs you will stop along the way. We will tell you which one and when. Some will be introduced along the way, like Septrin. We give you Septrin. You start giving your baby Septrin at 6 weeks, and we increase the dosage according to weight. When the weight increases, we increase the dosage. While nevirapine, we increase dosage depending on age, not weight. Age of the baby, we increase it like that. So nevirapine and Septrin, you keep on giving your baby up to 6 weeks. 6 weeks post cessation of breastfeeding. This, remember that the baby is breastfeeding, and breast milk also has some quantity of virus. So it is important for you to take your drugs faithfully. You are there properly. Don't miss your drug even for 1 day. Same to your baby. You keep your clinical appointments. We'll be assessing your adherence. We'll be assessing so many things on you. When you give birth, mode of feeding for your baby, we prefer exclusive breastfeeding for 6 months. Then at 6 months, after 6 months, you start introducing semi-solid food, that is weaning. You can do mixed feeding until a time when you stop breastfeeding. I do not want to mention what time, because different organizations prefer different ages, so that will be according to what your healthcare provider will tell you. Remember, ladies, what I'm trying to say is that you have to go to your healthcare provider. Do not go to a pharmacy, buy drugs, and start managing yourself using what I'm giving here. I am telling you guys that you have to work with your healthcare provider, because there are some things that we are doing for you. We are doing everything virtually anyway. We are doing everything for free. You don't pay anything. But if you go on your own, they are very expensive. For example, when you do dry blood spot for your baby at 6 weeks, 6 months, and 1 year, checking if they're HIV positive or not, we take the samples to the lab so that polymerase chain reaction is done to see if your baby is negative or not. That test is very expensive, and yet donors pay for it for clients for free. So come to us. All these things I'm talking about, we'll give them to you free of charge. We know what we are doing. We'll give you pieces of advice for free. Yeah, so please share, as I have said. Subscribe. Next time I'll be handling ladies who are HIV negative, how to maintain your negativity. Thank you for watching. If you have a question, please leave it on the comment section. I will handle it. See you next time. Bye.